We are describing a technique of endoscopic assisted fibular reduction with full percutaneous fixation of ankle fracture dislocation. This case is a large Hansen supination external rotation type fracture dislocation with disruption of syndesmosis, and CT 3D reconstruction scan was done after the close reduction. The patient is placed in the vorpilateral position with a pneumatic thigh tourniquet. Fibula endoscopy portals and screw trajectories are designed under fluoroscopy as shown. A proximal posterior portal and distal anterior portal are used at the fracture end. An accessory portal can be used if needed. All portals are interchangeable for viewing and instrumentation. Using proximal posterior portal as viewing portal, a hemostat is used to bluntly create the surgical plane. An arthroscopic shaver is used to clear the soft tissue covering the fracture end. Care should be taken not to damage the overlying skin by facing the shaver end away from the skin. Overlying periosteum can be cut open with arthroscopic scissor, and further debridement of hematoma and soft tissue is performed. The fracture gap can be entered afterwards. After the fracture gap is entered, excessive fracture hematoma is cleared with arthroscopic shaver along the fracture zone to help expose the fracture end for subsequent reduction. Using the distal anterior portal as viewing portal, further debridement of fracture end can be performed with hemostat or arthroscopic shaver. Excessive periosteum dissection should be avoided to preserve blood supply. Endoscopic examination of fracture can be performed afterwards, and the fracture gap should be clearly seen under endoscopy. A percutaneous reduction clamp can be used in this case, and the reduction can be directly visualized under endoscopic view. The process is repeated till satisfactory reduction is achieved. The reduction is then held with K wires and fixed with 3 cannulated leg screws. The number of screws and trajectories are designed by the fracture pattern. After fixation, the fracture reduction can be checked under both endoscopy and fluoroscopy. Subsequent reduction and fixation of remaining fractures can be done in usual ankle arthroscopic manner.